Another question that I was curious about, and this is something that I know is still unclear to many scholars, is the idea of authorship. We talked a little bit of You talked a little bit about that just a moment ago when you were talking about Tao Hong Jing, but it, my understanding is that the chapters 5 through 14 of the Shanghen Lun were considered to be the the work of Zhang Zhongjing. That the majority of scholars believe that. Where does this question of authorship come in and why?
Um, there are a couple of reasons. Part of it is, for the early chapters, part of it is a question of editions. We have multiple editions of the Shanghan Lun. They're variant editions. They aren't identical. Um, in most of those, the early chapters vary. So, for example, chapters 1 and 2, or no, what chapter 2 does appear. The most complete variant edition is called the Jingwei Yuhan Jing, which, despite its name, is a variant edition of the Shanghan Lun, not the Jingwei Yaolui. And even some famous physicians made that mistake of getting confused in that point. But uh, in the Jingwei Yuhan Jing, if I remember correctly, it has chapter 2, but not chapters 1 and 3. Now, I'm trying to, I don't have it sitting in front of me, and so I can't quite remember. But if I recall correctly, chapter 4 is the chapter on tetany, dampness, and summer heat, which is almost identical to the chapter that appears in the Jingwei Yaolui. So that also is probably authentic as well, but there is a question of whether that's about cold damage at all, and why is it there? And that's sort of an open issue. Um, so the first chapter, they vary a lot from edition to edition, which raises questions. The one that's most critical on this point probably is chapter 3, which is called Shanghan Ni. I read that as sort of precedents or examples of cold, or actually of types of cold damage. I think is my latest translation, because it's this chapter where it most explicitly states that cold damage includes warm disease, hot disease, which is an old name for summer heat disease, as well as true cold damage. Um, so, and it also has a whole discussion of seasonality and things like this and there, and if hidden chi and things like this problem. So, but it has towards the end in the text itself a reference to Zhongjing in the third person, which obviously makes people suspicious. It could have been that reference could have been stuck in there by somebody else later on, but it could be the whole text doesn't belong there originally. And that's what most people suspect, is that this is a later edition by someone. They usually say Wang Shuhe, but in all honesty, historically speaking, there's no good reason to say it was him. It's just because we know he edited the text at one point. But there's good reason to suspect that the edition of the Shanghanlun we have now, as opposed to the Jingwei Yuhan Jing and the Tang edition, Tang and Sun Yao's work, did not pass through Wang Shuhe's hands. That's a complex argument, but if that's true, of course, and it wasn't Wang Shuhe who added this to Shanghan Li. But anyway, so that's why those are sort of questionable. The ones at the very end, after chapter 14, are all called the Kebu Ke chapters, which means the can and cannot, because they're all in the form of, chapter on when you can promote sweating, chapter on when you can't promote sweating, etc. And these are more or less rearrangements of the same lines that occur in chapters 5 to 14, but all under the theme of what you can and can't do. But to make things more complicated, they aren't identical in all cases to the lines in chapters 5 to 14. So, for example, line 51, which in the original text in chapters 5 to 14 says, if the patient has a fever, you can promote sweating, give ma huang tang. In the you can promote sweating chapter, which is like 15 or 16, I think it's 15, says, no, it should be 16 because can't comes first. So it's probably 16, but at any rate, says, if the patient has a fever, you can promote sweating, give wei tang. So again, this is a complex text. It's been edited by many hands over many years. I mean, this is a 2,000-year-old text. It's complex. But there's, given that the original, the chapters 5 to 14 have a coherence to them, albeit sometimes hard to discern, it seems highly unlikely that Zhongjing would have just repeated that stuff again afterwards. And not every edition of the Shang Hanlun has these can and cannot chapters attached to it. So most people think that's added later. That part does smack of Wang Shuhe because he has very similar chapters in the Mai Jing, the Pulse Classic. But it becomes very complex because the Pulse Classic, the Mai Jing, was also, this is another text that was edited in the Song Dynasty, like the Shang Hanlun. But when the Song editors got a hold of it, it was already badly corrupt. And in reconstructing it, they drew upon many other texts, including the Shang Hanlun, to reconstruct it. So there's a similarity. Is it there because the two texts have a genealogical relation? Or is it there because the Song editors borrowed from the Shang Hanlun in rebuilding the Mai Jing? We don't know.
Right. Yeah. A lot of complexity there. So again, here I'm going to ask a slightly historically based question. And it's something that you touched on in a previous answer, which is you mentioned the Han history, and that in that text there's this category called Jingfang. And there are some scholars, the one that I'm most familiar with would be Feng Shilun, who believe very strongly that there is a distinction between Jingfang medicine, which is represented by the Shanghanlun Jingui and Zheneng Banzao, and the medicine that was influenced by the Huangdi Jing and the Nanjing. Where do you stand on that idea?
Probably somewhere in the middle. I think it's very clear there was in the Han a separate sort of tradition that we could call canonical formulae or classical formulae, depending on how you want to translate the Jing character Jing here. We don't know a lot about how different it was from the Huangdi Jing, simply because we have so little surviving of it. My guess is that it probably was somewhat different, but probably did draw on some similar ideas. It seems pretty clear now, as much as anything from that period can be clear, that the Huangdi Jing was a very innovative text in its time. That the people who were promoting it seem to have seen themselves as doing something new. And for that reason, I suspect that it is not, we should not think that everything from the Han would have looked similar. In fact, the odds are they didn't. We may know more about this in a few years. They discovered archaeologically recently some material that it claims to come from other traditions. This is the stuff I think they're saying is ascribed to Bianque, if I remember all this right, and from the news. If that material turns out to be what they think it is, we may get a vision of what other Han traditions of medicine were doing that we haven't ever seen before. And that may open up a whole new world of ideas to us. However, as far as Shang Hanlun goes, there's, in my opinion, a pretty abundant evidence that that Zhongjing was using some ideas, at least, from the Huangdi Jing, or which is appropriate, we should have Huangdi Jing corpus. Because it's important to remember the Huangdi Jing, as we know it, didn't exist then. The various texts that are part of that are given the name Huangdi Jing, remember there are 4 of them, are all, we could say, recensions. They're compilations from a common corpus of much shorter texts that are then put together in different ways to make different texts. And there's a long history behind that and why it is that way. But it's pretty clear that Zhongjing was drawing on some of this material. There's a disputed part of the preface to the Shang Hanlun, which claims to say he was drawing upon the Su Wen, the this, the that, you know. I agree with those people who say it's unlikely this is originally part of the preface. It looked like a commentary on the preface, basically. However, it looks accurate in the sense that it's been shown pretty clearly that there are parts of the Shang Han Lun where he seems to be drawing upon ideas sometimes that look very, even in the words used, are very close to Neijing thing material. The most dramatic one to my mind is one highlighted by a Beijing physician, Pei Lao Shi, teacher Pei, we'll call him. The last I heard, he was still alive, but he's very old. I'm not sure. That's been years ago, so I don't know for sure now. But Pei Yongqing, I'm pretty certain that's right. But he looked at the famous line where it says that if the patient has had Taiyang disease for 3 days and you've already promoted sweating, and if the qi surges upward, this is the key phrase, the qi surges upward, then you can give Guizhi Tang again. So this has led to a whole bunch of arguments about for 1,000 years now about Guizhi, the herb, treating upbearing, qi that surges upward, which is puzzling because it doesn't make a lot of sense, right? I mean, even in the famous Guizhi Jia Gui Tang, where you're treating running piglet disease, you're not subduing the running piglet disease, you're strengthening the heart yang to control the kidney yin and thereby cause the running piglet to descend, because this is a yin form of running piglet. It's a yin qi that's surging upward. So to me, it's always seemed like a weak argument. What Pei Yongqing argues is that if you look in the Ling Shu, in its discussion of the channels, when it discusses the channels, when it gets to the Taiyang, the foot Taiyang channel, it tells you that if the qi surges, or it doesn't say surge actually, it says if the qi is the term they use in this chapter is moved literally, but basically if it's affected by an external evil, essentially is what that means, then you'll have, and it lists symptoms, and there are things like headache, fever, etc. But at any rate, essentially, the same symptoms in the Shang Han Lun are the symptoms of Taiyang disease. And so Pei's argument was, and I think this is quite brilliant, that when Shongjing says surges upward, what he's telling us is simply, if the patient still has Taiyang disease symptoms, if he still has headache, fever, stiff nape, then you can still use Guizhi Tang. In other words, there's nothing fancy about the qi surging up from the abdomen. It's all just saying, if the symptoms are still Taiyang symptoms, give Guizhi Tang again. This makes a lot more clinical sense to me than most of what's been said for the last 1,000 years about that particular line. But things like that, and there are a couple of other places similar to this, where understandings where you can find a passage in the Neijing that clearly resonates with what's happening, you're seeing in the Shang Han Lun. Now, Feng Shilun's argument, which he takes from his teacher Hu Xishu, is basically about the Re Lun, chapter 31, if I remember, the Su Wen, which presents the 6 channels of cold damage. But it is true, as he says, the Re Lun and its presentation of the 6 channels and the Shang Han Lun presentation of the 6 channels have almost nothing in common. So in that sense, yes, no connection. But I think to go from that to the fact that there is no connection at all would be going too far. There is a connection, but not from that particular chapter. So.
All right. Thank you for weighing in on that. That's always something on my mind when I'm thinking about the Shang Han Lun and the Jingui as well.